We toss around words like anxious and paranoid pretty casually, but when does that everyday worry actually cross a line into something else? And what is the real difference between the two, clinically speaking? Well, that's exactly what we're going to break down. It's a question that probably hits pretty close to home for a lot of us. I mean, when your thoughts are just racing, how do you know if it's just a ton of stress or if your brain is maybe, weaving a story that doesn't quite line up with reality? Let's get to the bottom of it. Okay, so first things first, let's get a really important clarification out of the way. In the medical world, the term paranoia isn't really used for diagnosis anymore. The condition we're actually talking about is now officially called delusional disorder. And this is more than just a name change. It gives us a much clearer, more precise way to understand what's really going on. So let's dive in and start by just tackling that confusion head on. It's so easy to mix these two things up because, honestly, they can feel connected, but they are fundamentally very, very different experiences. And to really get that difference, we have to be super clear on what we're talking about. So let's define each of these conditions on its own terms. So first up, we've got generalized anxiety disorder, or GAD. Now, this is not just the normal stress you feel before a big deadline or an event. This is a constant, over-the-top worry about all sorts of different things. Your health, your job, your family, and it gets so persistent that it can really start to get in the way of your daily life. Okay, now let's switch gears to delusional disorder. The key word here, the most important word, is belief. This is all about holding on to a fixed, false belief, what's called a delusion, that just will not change no matter how much proof or evidence you show that it isn't true. So you see, it's not a feeling of worry, it's a deep conviction about reality itself. Right, so we've got the definitions down, but what do these conditions actually look and feel like in a person's life? Let's put the symptoms side by side so we can really see the differences in action. Now, this is where it gets really interesting when you see them compared like this. Over on the left, with anxiety, the symptoms are so often felt throughout your whole body and mind. That restless feeling, the fatigue, tense muscles, your body is basically stuck in high alert mode. But then you look to the right, and delusional disorder is primarily rooted in thought patterns. Sure, your mood can definitely be affected, but the absolute core symptom is that unshakable false belief, which can sometimes even bring on things like hallucinations, such as hearing voices. And this right here is such a key distinction. Someone with delusional disorder might seem to be functioning perfectly fine in most parts of their life. You might not have any idea that anything is different until that one specific topic, the subject of their delusion, comes up in conversation. It's a much more sort of targeted break from reality compared to that broad, all-encompassing worry that comes with GAD. But where do these conditions even come from in the first place? Let's dig into some of the potential origins and triggers for both of them. When we look at the causes, you can see there's a pretty big difference in what we know. For anxiety, we can often point to things like genetics, trauma, long-term stress, even social factors. But for delusional disorder, the picture is a lot foggier. The exact cause is still a mystery, but research does show some links to things like substance use, extreme psychological distress, from isolation, for example, and certain neurological conditions. So how do doctors sort all this out? Well, it's a really careful, step-by-step process. First, they have to rule out any biological issues with things like lab tests and scans. Then, they do a deep psychological assessment, using the official criteria from a guide called the DSM-5 to evaluate the symptoms. And finally, they zoom out and look at the big picture, a person's life story, their family history, and any possible triggers. Now, here's the most important thing to remember. Both of these conditions are treatable. But because they're so different, the treatment plans have to be specifically tailored to each one. And this table just lays it out perfectly. For anxiety, something called cognitive behavioral therapy, or CBT, works really well, often paired with antidepressants. For delusional disorder, though, the approach is different. The focus is more on general psychotherapy and a totally different class of medication called antipsychotics, which are designed to specifically target the delusions. And this is exactly why getting the right diagnosis is so incredibly important. It points you down the right path for getting better. But, life isn't always so neat and tidy. What happens if there's an overlap? It is absolutely possible for someone to experience both at the same time. In a case like that, the treatment plan gets adjusted. Doctors will often use antipsychotic medication to deal with the delusions while also using all the standard therapies and meds to manage the anxiety. All right, let's zoom back out and pull all of this together. What are the main takeaways here? The most crucial points to remember? Let's just ask the question directly, because it's a natural one to have. I mean, think about it. If you truly believe something false and scary was happening, that would almost certainly make you feel anxious, right? And the answer is a big, clear yes. Someone can absolutely have both conditions. And that right there is precisely why understanding the difference is so critical. Being able to tell them apart is the most important first step to making sure a person gets the right help for what they're truly going through. Honestly, this quote just says it all. Anxiety is about the feeling of intense worry. Delusional disorder is about the belief in something that isn't real, an interpretation that just won't budge no matter what. One is mainly an emotional state, and the other is a cognitive one. That's really the heart of it. So we'll leave you with this to think about. Now that we have this better understanding, how can we all be better at listening to and supporting the people in our lives who might be struggling? It's a question worth asking. Thanks for tuning in.